How are you guys? Nice, good? Yes. So I want to ask you if you have any patient to recruit in my prospective study, recruiting children with respiratory infections who are admitted to the hospital. Within 24 hours, I do on them lung ultrasound. Yes. And we're comparing this to discharge diagnosis. Mm-hmm. So I'm not blinded to clinical manifestations or labs, but I'm blinded to X-ray findings. Okay. So do you have any patient?
Yes, well, we have a 3-year-old boy with pneumonia on chest X-ray.
No, you should not tell me about the X-ray finding, okay? So I'm supposed to be blinded, so I will not look at the X-ray. So where's that boy? Can the parents will sign a consent?
Yes, we can.
Okay, let's go and see. Hello guys, how are you?
Hi, doctor.
What is good?
Yes.
I'm here to ask if I can recruit a patient in my study. I am having a prospective study recruiting pediatric patients who are admitted to the hospital within 24 hours with respiratory infections. So I'm doing on them lung ultrasound, I'm comparing the lung ultrasound to discharge diagnosis. Yes. I should be blinded to X-ray findings, but I'm not blinded to clinical manifestations, vital signs, history. So do you have any patient that I can recruit?
Yes, we have a 3-year-old boy with pneumonia on chest X-ray.
So you should not tell me about the X-ray finding I just told you. So unfortunately, I cannot recruit this patient because I am supposed to be blinded to X-ray findings. So next time when you have any patient, please don't tell me the X-ray finding. Okay?
Okay.
Thank you. Thanks a lot. Yes. Hello.
Hi.
How are you?
I'm good.
Everything's great.
How are you today?
Thank you.
You good?
Good. Yeah. How's everything?
I'm great.
How are the diabetic patients here?
They're good. They're good. I see some of them every day. They're good. They're following up.
So I'm having a good news.
Oh, really? What is it?
We are having a study on diabetic patients who are insulin dependent, and I want to ask you if you want to participate in this study. So we're doing it in many hospitals.
Really? Okay.
We're providing with our insulin X. First dose we give them free of charge. We can enroll them in the study. We're checking HbA1c on them, and we help the research team with $100 per patient for research expenses.
Really?
So yes, we are providing this study in many hospitals. If you want to participate, we'll be more than happy.
So for every patient that is enrolled, I get $100?
Yes.
Yeah,
Yes, for your expenses. Yeah, you can switch patients to our insulin, and we have a fund for that. We can help the research process.
Really? That sounds good. Honestly, I can switch all my patients. They start taking this drug.
Yes.
Yeah, it sounds good.
So great. Great. We can start whenever you want.
Start today.
Okay, good, great, perfect. So I'll get the papers and we start.
All right.
All right. Thank you.
Thank you. Yes.
Hello.
Hello. How are you?
Good.
How's everything?
Thank you. Thank you. Yes.
Good.
How are the diabetic patients?
They're good. Some of them are doing better than others, but they're fine.
So we have good news for them. We're providing a study on diabetic patients who are insulin dependent. We're providing our insulin X for them free of charge. You can try it on them. We're checking HbA1c after 3 months. We are able to support your research team with $100 per patient as help for the research expenses. So if you want to engage in the study, you will get $100 per patient. You can switch your patients from insulin Y to insulin X, and we check A1C and see what happens, the efficacy of our insulin.
Really? Listen, I appreciate you coming in with this idea, but I need more info. Do you have an IRB approval?
No, we did not apply for IRB. We're having this study for our company, so we are checking the efficacy of our insulin this way.
Really? Can I at least look at the study design and protocol?
Yeah, this is the study, I'm telling you. Maybe I can have a draft, I can write something for you, but this is the process. The enrollment, we're having insulin-dependent patients, and we're providing the insulin, and that's it.
No, that's not how things work. This is a direct breach of research integrity. There's a clear conflict of interest, and I cannot participate, we cannot accept the money.
I see. Okay, so although many hospitals are participating with us.
That's not how things should be done. We cannot accept the money.
Okay, thank you.
Thank
Have a nice day.
You too. Bye.
Hello, so how's Lamar?
She's okay. She's had better days.
How old is she? She's 6 months now, right?
Yeah, she just turned 6 months.
Great, we have a study for asthmatic patients. She has to participate in the study. Wait.
What type of study is that?
Hello? Hello, Hiba? Yes, can you come please? I have a great candidate for the study. Okay, great. Thank you, thank you.
Hi, how are you?
I'm good. How are you?
Good. It's Hiba, the research assistant of Dr. Kristal.
Nice to meet you, Hiba.
Nice to meet you too. So she has told me that your daughter Lamar is now 6 months old and you're following up with her in clinic.
Yes.
Okay, so we actually have a study where we blood of babies who are asthmatic and we're measuring the level of vitamin D in their blood.
Okay.
And Lamar is a great candidate for this study.
Okay.
So we'd like her to participate in.
okay, you will have to withdraw blood from her, right?
Yes, actually we do.
And the doctor thinks it's a good idea. What does
She's a great candidate for this study.
Okay. Okay, fine. If the doctor thinks it's a good idea,
Yeah.
I will let her participate in the study. I usually don't like her getting pricked because she has very deep veins.
Mm-hmm.
But if the doctor thinks it's the right thing to do, then okay.
Yeah,
I will
actually, she was insisting that she is a good candidate for the study.
Okay.
I'll give you the consent to sign.
Hello, how are you?
I'm good, thank you. How are you?
Good. How is Lamar doing?
She's fine. She's had better days.
How old is she now?
She just turned 6 months.
Oh, okay. We have a study for asthmatic patients. She could be a great candidate if you agree for her to join.
Okay.
I can call my research assistant Hiba and she can come explain everything to you. Do you agree?
Yeah, sure.
Okay. Hello, Hiba? Can you come please? I have a candidate for the study. Thank you.
Good morning.
Hi.
How are you?
I'm good. How are you?
Good. It's Hiba, the research assistant of Dr. Kristal.
Nice to meet you, Hiba.
Nice to meet you too. She told me that your daughter Lamar is a candidate for a study which we're conducting. So let me tell you a bit about this study. We're measuring the level of vitamin D level in the blood of asthmatic babies.
Okay.
She's 6 months, right?
Right.
So she's actually eligible for this study.
Okay.
You need actually to understand that your participation in the study is totally voluntary. You can choose to accept it or not. And even if you are actually accept to participate, you can withdraw your participation at any time.
Okay.
So would you like to participate or not?
So you mean you will have to withdraw blood from...
Yes.
Well, Lamar has very deep veins.
Mm-hmm.
And I don't like pricking her very much unless necessary.
Alright.
So I think I will pass this time. I don't think I will let her
Alright.
enroll in this study.
Alright, that's your right, for sure. I understand.
Okay.
So I just want to make sure that you get the point that your participation is totally voluntary. This is not going to jeopardize your relationship with the doctor, with the institution. She's going to get all the care that she needs. And it's your right for sure to reject participating in this study. It was nice meeting you.
Nice meeting you too. That's good to know. Thank you so much.
You're welcome.